I heard a heartbeat where once no sound remained.
I'm not Randy Travis's doctor, and I have absolutely no inside information here, but I think maybe I can explain a few things about cardiomyopathy. It's such a difficult word, even like what does it mean? So cardio is heart, and myopathy is a problem with the muscle. So there's a problem with the muscle of the heart, and there are a lot of different causes of it. One cause is just underlying heart disease. The blood vessels that supply the heart are too narrow. You can get heart attack and scarring and a problem with the heart from that. You can get heart valve problems. You can have high blood pressure. Or you can have an attack of the muscle of the heart by a virus. That's called viral myocarditis, and that can lead to a cardiomyopathy, which we're told is what Mr. Travis has. One other toxin that's associated with a cardiomyopathy is alcohol. Alcohol is a direct toxin to the heart and can certainly cause a cardiomyopathy. Now, there are a lot of people who drink a lot and never get cardiomyopathy. We have no idea exactly what's going on with Mr. Travis, but one scenario in the case of somebody who has a viral infection is the virus attacks the heart muscle. That's called viral myocarditis, and the heart suddenly stops working normally and the person goes into heart failure. The symptoms of that are shortness of breath, the lungs get filled with fluid, and there's not enough blood that's reaching parts of the body. Ultimately, if the heart doesn't return to normal, the person's going to need some type of chronic therapy. That includes medications to control the blood pressure, to try to relax the blood vessels so that there's less work that the heart has to do, and to generally make sure that the fluid status of the body is correct. There may also be assist devices. People can go home with what's called an LVAD device, a left ventricular assist device. Mr. Cheney went home with that and had that for a couple of years before he got his heart transplant. And then ultimately, if the person is home and on medication and or some assist device and is still not doing well, they may ultimately need a heart transplant.